This afternoon, we know that there have been 5 new cases recorded on the ground in the Ashanti region and the Eastern region. We'll take a look at the breakdown of the regions as well. And if you are in the Ashanti region or the Eastern region, I'd love to hear from you. Do send me a message about how you feel with all the cases that have been recorded, how you feel about our response so far, and what you think will be the most effective way of educating people who live in your area to be observing the social distancing and also wearing of masks. In the Ashanti region, 62, the Eastern region, 51. But if we have to add the figures that we know of at the moment, you know that the figures will certainly go up, but we'll wait for the Ghana Health Service. In fact, we have had these cases confirmed already. By the way, the Western region has 1 case so far. Volta region has 9 cases. I'm going to go on the phone lines now, but some of you are still sending in your messages. We'll read them right after this conversation. Ato Coleman is a complex emergencies expert, fellow of Imani Ghana. He's a former country director for Plan International Sierra Leone. He joins me for some analysis on Ghana's situation at the moment. Mr. Coleman, thank you for your time this afternoon.
Good afternoon. Thank you for having me.
What's your general perspective of what is happening with the COVID-19 and how Ghana has responded generally?
Yeah, thank you. I think I will look at it from, 8 main angles. Number one, I will look at values and behaviors because the COVID-19 pandemic response has to be guided by the global humanitarian standards. And there are a few of them. It includes, number one, do no harm. Number two, you have to be impartial when you are delivering the services during a disaster situation. You have to treat affected population with dignity. You have to respect the local customs. You have to ensure local ownership. So for me, these are values and standards that should guide any humanitarian response intervention. So that is number one. So I want to list the values, the factors, and then I'll give you my assessment based on that. So I'm going to look at values and behaviors with respect to how our leaders and our responders have engaged based on the information that we have seen on TV and read. So I'll look at that. I will also look at the extent to which government has organized the execution of the response. When I talk about the execution, I'm talking of how government is managing the way the response is delivered. You know, you have to work with epidemiologists, you have to work with laboratory technicians who do the testing, you have to look at risk communication. You know, there are so many aspects of it, the organizational model. I will look at that and I'll give you a feedback on that. Then also I will look at the whole bit about accountability and transparency in communication, which is also very important. And then data and technology, the extent to which government is leveraging data and technology. So if we take the first point on values and behavior, I think by and large, I have not seen many cases where harm has been, done to affected populations. There have been some few cases of brutalities against a few people, I think by the security agencies. But I think whenever those reports have occurred, I have seen that authorities have taken measures. So from a values and behaviors perspective, I think that is my reaction to that. And then I think the president's regular update, for me, is also consistent with making sure that Ghanaians are aware of where we are and also to enhance local ownership. That's number one. When it comes to the whole organizational model, how the government is managing the resources and the various pillars of the response, in terms of logistics, in terms of procurement, in terms of food distribution, in terms of the laboratory testing, in terms of the epidemiological aspect. I think by and large it has not been bad. So I don't have any issue to do with that. My only concern is the logistics aspect and the rather unfortunate and terrible way that food distribution has been done, which I think the few images we have seen on your own television station, also poses more risks to the affected population. So I think the logistics aspect in terms of food distribution has been erratic and a bit unprofessional. Okay. And I don't think it is in line with the humanitarian stand. Also, one area that I think has not been too positive for me is the images where we see politicians who mean well, ostensibly, but then when they make donations, they put their logos and their names and their parties on the Veronica bucket and also on some of the relief items. I think it goes against the humanitarian standard of impartiality, because in the humanitarian situation, you should not use the delivery of service to drive a particular religious or political stand. So I think in that aspect, there's a lot to be done. Okay. Now, if we now come to the aspect of strategic objectives, the overall strategy of the government in COVID-19, I think there are, in as much as the president gave very clear objectives why he did the lockdown in order to limit and stop the importation of the virus, to contain its spread, to provide adequate care for sick people, to limit the impact of the virus on socio-economic life, to inspire the expansion of the domestic capacity. These are very important strategic objectives that I think Ghanaians should have their minds to, because then it helps you to hold the government and the president to account. I think the strategic objectives have been clear. What I think has been lacking is the availability of the government's overall response plan, published in black and white, that every Ghanaian can have access to, and then it helps you to know, this is the direction government is going, these are the indicators of what success looks like, this is where they are, this is what has worked well, this is what has not worked well, and it helps us to hold government to account, to ensure that there's accountability for the funds that are being used to fight the disease. Then the bit about data and technology, which I love very much. I think that there has been a very impressive effort by the president and his team to leverage data and technology. You've seen that, yesterday when the president, lifted the restrictions, Sunday when he lifted the restrictions, he said it was informed by the data and the science, isn't it? Yes. And I think he showed us, the samples that he have collected, 86,000, samples that have been tested, 68,591, which is about 80% of the universe sample, 1,042 positive, which is like 1.5% infection rate. 99 out of the 1,042 have recovered, which is a recovery rate of like almost 10%. That gives you an indication that government is using data and not emotions, to support decision making. I think that is very commendable. Of course, some people have said that 20% of the sample is still yet to come in. That is 18,000. And so why didn't government wait for the 18,000 to come in and then maximize the data for decision making? But I always say that as somebody who has worked in a humanitarian context before, you don't always have the benefit of 100% of the data before you take a decision, because it is a crisis situation. So I think the president and his team, and the balance of probabilities, they decided that based on the risks that we know and the risks that we projected and the extent to which we can cope with the risks when they occur, 80% of the data is sufficient information to inform our decision making. There's nothing wrong with that, you know. But somebody will say, you know, you should get 100% of the data. That is the ideal situation. But on the field, you don't always have the luxury. Then let's look at the science. I think the science aspect of it is also something that has fascinated me, and which is very important because, you know, science helps to give you knowledge that informs your decision. So data and science, if a leader is making decisions based on data and science, I think that the probability that the decisions will be well enriched is very high. Now, the president shared a very wonderful news. But what interests me is that a lot of people have not made noise about that. But I think that is where the noise should be. The fact that our scientists at Noguchi, the University of Ghana, have been able to sequence the genome and you know done some work analyzing 15 samples and done some work on the genetic makeup of the virus. For me, this is a game changer in the fight.
Okay.
You see, because that information is very significant because it helps you to gather information on the genetic makeup of the organism within the virus. It helps you to track and compare if the virus is mutating or not. And then it helps you to understand the characteristics of the virus and its strain. At the end of the day, it helps you to enhance your surveillance. Right. It helps you to understand and project the sources of community infection and spread. You see, so this is the foundation of the fight.
Okay.
The science is the foundation of the fight. So I think this is very positive news that we should be celebrating.
We should be celebrating.
Even as we hold government's feet to the fire. But more importantly, I think this is where your interest is how has the response been delivered on the ground, and what gives us confidence that government has the capacity to fight the disease. And for me, if you listen to the update, the 7th update of the president,
I actually do have a quick follow-up before you go on so that we can wrap up. And it is that you indicate that in terms of the strategy objectives, that government has not really made available an overall plan that all Ghanaians can perhaps follow. To what extent will that change our response and make it any more effective?
Oh, wonderful. If you are executing a humanitarian response program, you need to have a plan. Now, the plan has few elements. The plan helps you to measure if you are going on track or off track. You know, it's like if you are running a business, you need to have a business plan, isn't it? And then you need to have a way to deliver your business plan. It's the same principle. If you are implementing a humanitarian response or a disaster management response, you need to have an overarching goal. The goal is more or less your theory of change, of what outcomes you want to reach, the destination of all that you are doing. What is it? You need to have it at the first level. Once you have the overarching goal, you then need to have your strategic objectives that helps you to deliver those goals. Okay? Now, beyond your strategic objectives, you then have to identify indicators of success. And then you define specific activities for each indicator that helps to deliver each strategic objective. You get my point?
I do get it.
All these ones should be measurable.
Okay.
And then when it is measurable, you can interrogate the implementation of it. You can monitor the implementation of it.
And then we can identify the gaps. We can identify the gaps and know what ought to be done better going forward.
As we speak, all of us are in the dark. You have seen it, but I have not seen it.
Well, I haven't seen it either, but this is like a whole lecture, trust me. And in terms of the content, the structure, the delivery, it looks like I've been in an hour of a lecture, I should say, which is very educative. But I think that we will be able to take each of the points one after the other and have a thorough discussion subsequently on this show. And it will be great to have you, so our viewers can see you. So let's work on this perhaps the rest of the week and see how we can break all the points that you've made down and interrogate it thoroughly.
Thank you.
Thank you so much for your time. I've been talking to Kingsley Atto-Coleman. He is a complex emergencies expert. He is former country director of Plan International and senior fellow with Imani. You can understand his research background, giving us, the detailing of his submission gives you an idea of that. I must also say that he was part of the Ebola response plan in Sierra Leone, so he has a fair idea of how to handle national emergencies. We'll be talking to him subsequently, so we'll break it down like I said.